Over the years, the Nigerian government has been working to improve the country's primary healthcare delivery system. But it has become clear that long-standing stubborn issues in primary healthcare will require new ways of problem solving, especially with the coming of COVID-19. In 2020, the Core Nigeria project, led by Scope Impact, as part of its aim of implementing a proven human-centered design HCD approach to improving primary healthcare delivery, set out to provide immediate solutions to the pressing COVID-19 concerns by working with the Nigerian government and the Clinton Health Access Initiative, CHI, to co-create innovative solutions that respond to people's needs and realities.
So we had a drop in uptake of services because people were afraid to go to the health facility.
Especially attendance of antenatal care, routine immunization. Women were not able to come into the facilities.
So SCOPE is a Finland-based non-governmental organization that's been working in development, particularly their expertise is in human-centered design approach.
It's entirely a new approach in problem solving within the public health space. And prior to this time, what happens is that you have the program already designed by the funder and given to an implementing partner to execute. But with this human-centered design approach, you need to now carry the activity with the stakeholders within the community, within the healthcare, within the local government, designing programs around what their current situations are, and then feeding back to the funder what truly the picture is and what the solution should be.
The human-centered design approach was, however, not well known nor utilized routinely in the Nigerian primary healthcare sector.
So, is it a create phase?
The challenges were clear.
Because you have to do a lot of mentoring sessions, you have to do a lot of the design clinics, the virtual network meetings.
Everything was done online.
We needed to get all these government officials through each and every step of the process.
So, having to be online for an hour or two, brainstorming and all that.
It was quite exciting for me when I saw, first of all, Core Network, what was it all about? And I think I spoke with them and they tried to explain. And I recall, as at that time, we had started talking to BMGF on the behavioral science using human-centered design in terms of the work we do. So I was quite happy to be part of it.
Through the Core Nigeria project, Scope designed a competency-based learning program in order to embed the use of human-centered design approaches as a complementary approach to tackling public health challenges in Nigeria. The program aimed to develop and deepen key competences such as participatory co-creation and empathic research, HCD mindsets such as empathy, creativity, open-mindedness, simplicity, collaboration, and action orientation. The Core Nigeria project, funded by the Bill and Melinda Gates Foundation, was implemented with partners such as the Clinton Health Access Initiative, CHI, Lagos State Government, and Niger State Government, as well as the federal government. This was done through three main components: the virtual network, design clinics, and HCD Basics. Core Nigeria's virtual network brought together a community of actors and organizations working in primary health care to meet one another and gain introductory knowledge of HCD tools and methods.
COVID-19 was something unprecedented. None of us have ever experienced anything like this before. So trying to adjust to the new normal, not only in terms of our personal lives, but even in terms of programming, designing, and coming up with strategies and interventions was a major concern, right? We had to depend so much on virtual platforms to be able to run through the HCD process.
We had Zoom calls to just interact, identify the problem statements.
We've had a series of phases, looking at the adoption of quite a number of tools to create a prototype.
During design clinics, the session participants were guided through the 4 stages of HCD: discover, define, create, and test, in order to learn by doing to develop their own innovative solutions to implement and scale.
The design clinic did change it because, you know, we went through these different stages. So we had 10 design clinics in total, and then at the end of the day, we were able to come up with some solutions.
HCD Basics is a self-directed e-learning course that helps individuals to learn the core principles of HCD and its application to primary health care.
They did their best to also try to support us with, providing some online supports and even tools and things like that, where we may not have that time to start generating those tools and things. They helped us to synthesize even some of the insights that will come out from our experiences in the field as well. So that was really helpful.
The scope of their work in Niger has been very deep, and it has really strengthened our primary healthcare system, to say the very least.
Despite initial challenges to revise the program in light of the COVID pandemic, Core Nigeria has been a resounding success.
This project, we ran it in sort of rural communities, not urban areas. So the most fulfilling thing is the humility that we have to approach with the work. We have to blend with the community for acceptance, for them to understand us.
Something that we tested, a concept that we're testing in 2 states, has a potential to be rolled out in other states, right? So I think that's encouraging, and that is going beyond the lifetime of this project, which was less than a year.
The way they've started, like engaging with us at the primary healthcare, and then going forward, they won't only be experienced with us, because we also, our state persons and local government and others are supposed to be part of this, so that they also understand how this will make their work easier.
2 innovative solutions to improve primary health care were tested and are ready for implementation. Over 150 key decision makers from government, NGOs, private sector, and donor agencies were introduced to HCD. An e-learning course is available for actors in primary health care to continue learning about applying HCD.
If we have a way of sustaining this program, we will be very, 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 very grateful. So if every one of us as health workers have this knowledge or capacity built, there will be a lot of change in the way and manner we render services to our people.
The aim now is to continue skills building and experience sharing in order to accelerate the knowledge and use of HCD in Nigeria.
This is even where the work starts, because you've gone through the discover, the define, the create, we've tested. We have this great idea now. We need to think of how we're going to test that idea, how we're going to scale it up,